All right, welcome everyone. If you're here for the strategies for getting your laboratory in network webinar, you're in the right place. We're going to be getting started here shortly. We're just letting everybody continue to pile in, and then we'll go ahead and we'll kick this off. Thank you for joining us. All right, so today's webinar, we're going to be talking about strategies for getting your laboratory in network. This is a category or a topic that has been coming up for the entire 18 years that I've been in this industry, and whenever we get into a roundtable discussion amongst lab owners or even chatting at a conference, this is always a pain point in our industry, is how do we work with the commercial payers to find ways to make sure we're in network and we're getting paid reliably. So I think we have a really valuable presentation for you guys today. This is a topic that I know you care about, and these are speakers that are going to be able to really add some value and shed some light on strategies for doing that, and they've helped successfully several of our clients to get in network. And so I've always been looking for a solution for this problem and have tried many over the years, and typically the billing companies that say they do credentialing will file some paperwork for you, but are not able to get you in network on many of the ones that you hadn't been able to get in network with in the past. I think Burns Consulting can be refreshing and be a good solution for you guys. That's why I wanted to bring it forward. As always, Lighthouse does this webinar for free. We do this as a service for our customers. And we do this as a way to help you guys grow and service the industry and be advocates for some of the topics that we know you guys need to hear more about, and try to be a forum for those conversations to occur. As we get started here, there's a couple of these housekeeping items. Is reduce your chances of buffering by closing any heavy bandwidth apps you may be having running in the background. This webinar will be recorded. One of the more common questions we get is about that. We will send it to you. It'll automatically be sent to you if you registered, so you don't need to do anything in order to get a copy of the recording. Usually takes about 24 hours before that link of the recording goes out. So be patient with us. We will get you that. No need to wait for the end to ask questions. We may be able to field those during it, but you can ask questions throughout. You'll see to the right of your screen, chat, QA, polls, and handouts as different options. If you go under the QA portion of that, you can ask questions there, and we will field a few of those questions if we have time at the end of this webinar. You can ask them throughout, and we may be able to grab a couple of those as we go through the slides as well. We will be running polls during the webinar. We encourage you to participate. If you click on the poll tab now, you'll see that we have a poll up and live for you to respond to, asking about which of these commercial payers has been the most challenging for you. Looks like United Healthcare is in the lead currently, with just a couple people responding so far. But we encourage you to go ahead, click on polls, be heard. It's always helpful for us to, as a group, learn from one another and get some data from that on what's going on a macro level. So we appreciate that. Lighthouse Lab Services, I'll give you a short pitch for kind of what we do. The way we're able to do this webinar for free is because we do provide services to labs, recruiting and staffing. If you need medical lab scientists, we do run the largest groups of medical lab scientists in the world on LinkedIn and Facebook. So would love to help you source talent. We've got about 170,000 resumes of credentialed medical professionals, medical lab professionals rather, in our database, and we'd love to help you fill those difficult to fill positions. So let us know if we can help with that. We do also offer consulting services. So if you're looking at adding a new line of testing, if you want to validate an LDT, we've got a team of PhDs that does that. Writing SOPs, doing a mock inspection. I know a lot of growth happened very quickly during COVID in some labs. Maybe some of that wasn't as buttoned up as you'd like, and we would love to come in and do a quick mock inspection for you guys to make sure your house is in order before the full inspection with CLIA, COLA, CAP, whoever your accrediting body is. We do offer laboratory management services where we'll run all the operations of your lab if you are not looking to be involved in that and you just want to focus on sales, marketing, or some other piece of it. We do offer our own LIS system, and it's a flat fee, monthly, no subscription, cloud-based LIS, and we're pretty proud of it. And so if that's something you'd like a demo on, let us know about that. And our laboratory director services. So we do offer, or we provide the medical laboratory director to 230 odd laboratories out there, high complexity labs that are MDs and PhDs direct. And so we'd love to give you a quote if that's something you ever need or a service you need. I think we do it better than anyone else, and we're usually able to source a lab director within 48 hours. So that's the end of my pitch. I appreciate you listening to it. There is a offer to respond on the screen there now. If you do need more information about any of those services or topics or want to have a conversation, just let us know, and we will make sure a representative reaches out to you to talk about your needs and see how we can help. Now I'd like to introduce Burns Consulting Group. I gave a little bit of an intro on who they are, but they have really just been a breath of fresh air in industry where I've always had struggle finding a solution for this one topic, getting in network. And so looking forward to today's talk. I'm going to go ahead and turn over the reins to Brian and Brendan Burns and let them tell a little bit more about themselves, because they're going to be able to do it better than I can. But they really do have a great background, and I think they're going to have a lot of great things to say. So I'll go ahead and I'll turn it over to Brian.
Thank you, John, and good morning to some and good afternoon to others. Brennan and I are super pleased to be on this call. We've been partnering with Lighthouse for quite a while now, helping their clients obtain insurance contracts. So just a little bit about us. We call ourselves a boutique healthcare consulting firm. We work in the entire healthcare ecosystem, but we really bear down and focus on the independent outpatient labs. We think these services help play a key role in our clients' business strategies. After all, these insurance contracts provide revenue, so it helps to monetize the lab, if you will. Some labs, some of our clients are brand new. They're startups, or some have been COVID only and up to now, and they want to get into other services. So we help with some go-to-market strategies with particular insurance payors that they're targeting to join. We also offer some other services there: managed care contracting, value-based care contracting is a big buzzword. A lot of times you just hear VBC for short. Those are risk-based contracts that the payers love to get providers into. Not too many in the lab space, but nonetheless, there are some out there. So just a little bit about us individually. So I've been in insurance for over 33 years, only on the payer side. Started with Prudential Healthcare, as you see, but really Blue Cross of Kansas City and then Blue Cross of Louisiana, two huge not-for-profits. Blue Cross of Kansas City is a probably $3.5 billion revenue not-for-profit in the Midwest, serving 1.1 million members. Blue Cross of Louisiana is another not-for-profit, probably $4.5 billion at this point, serving 1.7 million for the entire state of Louisiana. In both capacities, I oversaw three main areas: clinical pharmacy, provider network, and clinical solutions. In the provider network, like in Kansas City, there were 18,000 providers there. In Louisiana, there are 40,000. And the principal responsibility there is setting reimbursement strategy and network configurations. And when it comes to outpatient reference lab, network design and reimbursement strategies, like I have listed there, was always a key element in our discussions. Additionally, I also oversaw medical policies, accreditation. You'll hear me talk a little bit about NCQA and URAC, which are, from a payer perspective, those are our big accrediting bodies that we submit to. I know the labs submit to CLIA and CAP and COLA and others. But I'll also talk about health and wellness programs a bit, and how lab data and the quality of the lab data really helps on the payer side. And so anyway, that's my background: 33 years only on the payer side, and now helping independent labs get access to those networks. And with that, I'll turn it over to Brennan.
Hi, this is Brennan Burns, and thank you all for joining today. My experience ranges specifically on the lab side and working with labs. I began my career at Blue Cross Blue Shield of Texas, where I was managing their lab contracting network. And in that time, we contracted with, I'd say, about 150 to 200 labs. And so I became very familiar with the contracting process from the payer perspective. Following that role for several years, I then worked at a genetic testing laboratory in Dallas called Gulfstream Diagnostics, where I was responsible for managing their nationwide payer contracting initiatives. And following getting many contracts for that lab, they closed in November of 2018. And so since that time, I've been doing the same payer contracting that I was doing at Gulfstream, but as a consultant for a number of labs. And so that is what brings Brian and I here today. We've teamed up to bring his senior executive experience with my lab experience to try and provide a comprehensive service for our labs to get them in network.
Excellent. So just a level set, thank you, Brennan. Just a level set what we see as the current landscape. The field is crowded. There are a lot of outpatient labs in the United States, and they continue to grow, as I mentioned, as we wind out of COVID, and a lot of these labs are getting into more and more services. And all these labs desire payer contracts. So the best way to read this slide, by the way, is go left to right. These chevrons or bullets are intended to go left to right. So there are a lot of labs that are out of network. And so the goal is to obviously try to get in-network contracts, or what we call sometimes PAR contracts. And the best way to do that is to have a target in your mind of which payers you're really interested in. So if you're in Ohio, for example, do you ever have business in, let's say, Illinois? Or maybe you have a foothold in Texas, or you want to establish a beachfront in Arizona, or whatever your plans might be. Identifying your primary markets and your secondary markets is key. There's a lot of out-of-network lab expense. On the payer side, it's probably about 20%. But on the lab side, it's much larger. These out-of-network labs are a bit thorny for patients because of the out-of-pocket liability, the deductibles that we all know about from the ACA, but even the non-ACA plans have high front-end deductibles. And so from a lab perspective, that can increase your accounts receivable and potentially increase your uncollectibles or your bad debt. Surprise billing has gotten a lot of attention. Patients don't select their lab vendor. They pick their primary care doc, or the primary care doc refers them to a surgeon or whomever, and they use whoever lab they're assigned to. And the patient's dissatisfaction from some of this surprise billing has led to a lot of potential legislation in this area. The payers, for their part, have aggressive pricing, as I'm sure you all have experienced. And the reimbursement rates can be anywhere from 40% of Medicare to up to 120% of Medicare. Keeping in mind, payers, the commercial payers, more and more of them are getting into the Medicare Advantage space. Over 10,000 Americans turn 65 a day, so this is a growing population. So the commercial payers want to have their HMO networks and their PPO networks, but they're also standing up Medicare Advantage products, or if they already have Medicare Advantage products, they're expanding them. Maybe they just started with HMO and now they're going to do PPO. Or if they do PPO, they're going to have a small network and a large network. And so the number of networks to try to get into now multiplies. It can exponentially multiply if you're dealing with 5, 10, 15 different payers, and they all embark on this kind of strategy. as someone, there was a question that came up early in the Q&A. Some payers have closed networks, and we definitely see that. There are some pockets where there are closed networks, but what we try to do is two things. We try to drill down into what does it mean by closed, because like I was just saying, payers have multiple networks. At Blue Cross of Kansas City, I had 9, and it was growing. So HMO was only one network, but there were 8 others or 9 others. So we try to define with our clients which networks they're talking about are closed, or when we find out, we can try to work through some key strategies with the lab. If you have unique tests, that's that go-to-market strategy. We can help with slide decks and help position your lab in the best light to be viewed differently by a payer and get you in that network. The other thing I would say is some of you might be familiar with it's a peer-reviewed periodical called Health Affairs that comes out every month. And the June 2020, there's a great June 2020 article that in there they did an 8 or 9 year longitudinal study where the share of out-of-network lab spending is increasing while other healthcare expenses and trend is declining. So what does that tell you? I mean, so the competition on the out-of-network to get in-network is increasing. More and more services are being done. We know that we have an aging population, and the population needs services. And so lab is one of those key services that, I mean, outside of pharmacy, it's the most used healthcare service that a member uses under their benefit plan, under their health insurance. So lab is super critical, and it continues to grow on the in-network side, but the expense on the out-of-network side continues to grow too, and so we can help address that. So with that, Brennan will go through the next 3 slides.
Sure. So this list of Blue Cross plans is a list that we've seen quite a bit of success with in contracting over the past several months. Many of these plans, like Blue Cross Blue Shield of Illinois, Texas, Care First, and Michigan, they are in fairly large markets, like with Texas, for instance, covering 14 million members. So this is a list of some of the payers that we try to obtain for each of our clients to try and get them in markets where they can drive up test volume and also drive up their sales force and revenue. So we've seen a lot of success with these plans. In addition to this list, well, really there are kind of 3 buckets of payers that we categorize. There's a list that is largely open to contracting with new labs, which is here. And then there's another list of Blues that are closed, like Blue Cross of Oklahoma. I'm sure most of you are familiar with. It's very difficult to get into, if not impossible. And also Blue Cross of New Mexico is very difficult. But there's another list of Blues where we can get into them if we present any test offerings that you have that are considered unique or proprietary. So that's one of the first things we do when we bring on a new client, is to discuss any testing that could be considered unique or proprietary, and then use that to present it to the payers to try and make the case for why they should be admitted into their network. And so some of those plans where we can work on that are Blue Cross of Minnesota, BCBS Highmark, BCBS Florida. There's a number of payers where we can get into them if we can present something that's very unique and a value add to their network.
Brennan, there's a question about the Michigan status. Michigan is a Blue Cross plan that's listed here with 8 million members. I'm not really sure of the background there, Brennan, but is there, or the context of the question, but is there anything unique about Michigan?
Yes. So Michigan is an option to get in network with. It's not a guarantee. but it is a plan where we've seen a lot of success and would most likely be able to help that lab get a network.
Okay. We'll answer some more questions as we go.
In addition to contracting directly with Blue Cross plans, we've also had quite a bit of success contracting directly with Molina Healthcare. They are a growing payer around the country and are the 6th largest payer behind Blue Cross, UHC, Aetna, Cigna, and Humana. So we do a lot of work with them. In addition to that, we also apply and contract directly with state Medicaid plans. We're able to get into, depending on the lab's location, we've contracted with just about every state Medicaid plan in some capacity. In addition to Blue Cross and Molina, we've also contracted at times with UHC, Aetna, Cigna, and Humana. But again, those would be largely dependent on the unique or proprietary tests that we can present on your behalf to get into those networks. Because as many of you know, they present their network as being closed, and they really try to mostly work with Quest and LabCorp, unfortunately. So that's where we need to do the best that we can to present your test offerings in a positive light. And then Brian and I also use our connections that we've built over the years with contacts at each of those plans to try and get it to the top of their desk and make sure that your application is being reviewed ahead of maybe someone else that's just sending in the paperwork and filing it through their website or some other application method. And in the event we are not able to contract directly with those plans, some of the other strategies that we recommend are contracting with multi-plan or Three Rivers Provider Network, which are third-party payer organizations that offer reimbursement and coverage for the PPO and Medicare Advantage networks. And multi-plan covers many of those payers, UHC, Aetna, Cigna, Humana, as well as a lengthy list of other local and regional payers that are in various states around the country.
Good, Brennan. There was a question about your success rate or our success rate with Molina in Texas.
Yes, so we have seen quite a bit of success with Molina, Texas. They are an open network for the most part, but to get into Molina, Texas, you would need to have Texas Medicaid first. So that's something that we typically do and do many times is contract with Texas Medicaid, and then that enables us to contract with Molina, Texas, since they do a lot of government business. They cover Medicare, Medicare Advantage, Medicaid, and then HMO as well.
There was a question that I'll take. It was regarding the capitated deal between WellMed and LabCorp. Those cap deals typically are only on the HMO book of business, because there you have the health plans require a member, which y'all call a patient, but we call, on the payer side, we call them members, same person. That and the health plans require a member to select a primary care doc. And so doing prepaid capitated deals is very easy because you can identify that member. Can't do it on the PPO side, because the PPO is freedom of choice. You can go to any provider you want, you self-select. You don't have to select a primary care doc on PPO plans. And just to give the audience a perspective here, when I was at Blue Cross of Kansas City for those 18 years, of those 1.1 million members, we had maybe 80,000 HMO. And a lot of those are school districts or maybe Ford and GM, they have big plants there. But the main event across the country is PPO. Now, but within the PPO, you have all these various size networks, like I was describing earlier, the ACA, or people call it Obamacare, a lot of networks there, and just straight regular PPO products. Those products are typically not capitated because there are no assigned members to assign a capitation rate to. So we work with clients to figure out what is their goal, and we bring up what we typically refer to as the main event. And the main event across the country is PPO, and those cap contracts generally don't exist on the PPO like they do on the HMO.
Sure. And right before I dive into this map, I'd like to address a question from Paul. As far as Blue Cross Blue Shield of North Carolina and Avalon, that is one of those instances where we would need to either have an in-state location. Many times with these Blues plans, having an in-state location helps open up the network. But if Paul, if you're outside the state of North Carolina, it helps to have some sort of unique or proprietary test that we could present to Avalon's leadership, and then that would give us a good chance of getting you in network with them. And then looking at this map, this just helps visualize where we have access to. The red states would be where we have contracted directly with both Blue Cross Blue Shield and Molina Healthcare. The blue states would be where we have contracted just with Blue Cross Blue Shield, and then the green states represent where we have contracted with MultiPlan as well as Three Rivers Provider Network to get you coverage for some of those other payers from a third-party perspective. And then, as again, in each of those states, we would also be able to accomplish the state Medicaid contracts.
Very good. Mr. Saeed Habib is asking these questions about the joint venture hospital lab. I think that's what it is in Michigan. I'm really not trying to ignore you, sir, or any of these questions. I'm not totally familiar with that. We can certainly get back to you about that one. I did pull it up. It's in Elmhurst, Michigan, but I don't know offhand, unless you do, Brennan, anything about joint venture hospital lab in Michigan.
Sure. So I believe that's a specific work that's offered by BCBS Michigan, if I'm not mistaken. We have not worked with them in the past, but typically when we get a Michigan contract, it's for PPO and Medicare Advantage.
Perfect. Thank you. All right. Next slide. So I touched on this earlier. Lab values are a big deal on the payer side. And this is intended to be a bit of an informative slide to just let you know a little bit of what goes on the payer side of the fence, if you will, from a provider when it comes to lab tests and lab values. Payers are super interested in knowing what lab tests are being done, but we're more interested in the lab values. The reason for that is every payer organization in the country, and there are over 700 of them, have quality programs or population health management initiatives. Pop Health has been around for 25 years at least, maybe 30. And anyone on the phone in a quality management role would attest to the value that these measures bring a payer. And I give you an example here of the hemoglobin A1C, the metric that NCQA, which is the National Committee for Quality Assurance, you see their logo there. This is an important measure. There are probably 7 or 9 diabetes measures that payers are responsible for, but the main lab value one is this blood glucose one, HbA1c one, and there the metric is less than 8%. And so if we know someone from a payer side, if we know someone has had that test and we don't have the values, then we have to go out and find it. We got to go to the primary care office, maybe they have it, or we got to contact the lab. But if we get that connectivity, if we get those lab values from the lab network, then it makes our job easier. It's interesting to note lab expenses are less than a payer's annual claim spend. But these tests, like the pharmacy data, drive a lot of the clinical decision making, not just with the provider network, but also how a payer goes about their population health management initiatives. So, for example, if their network, if their membership seems to be more under control than not in that blood glucose, then they won't focus on that. It might be diabetic retinal exams, or for short, just DREs, or it might be something that has nothing to do with diabetes. They'll focus on some other area, but they don't know, a payer doesn't know what to focus on if they don't have all the data. And so I'm just trying to highlight that the role labs play in bringing in the specimens and running the tests, the quality tests that y'all run with your medical directors, getting those lab values is super important. And I would argue lab values are probably the most meaningful one, followed closely by pharmacy. In the pharmacy data is when you link those two together, the lab values, pharmacy data, and a couple other interesting claims, then the payer can get a real clinical picture or clinical profile of what's going on with their population, and that drives their initiatives to improve quality. So NCQA drives a payer accreditation, and the payers find that meaningful. There are different layers of accreditation. There's basic accreditation, there's commendable, and onward, and that helps the market, that helps the employers that buy insurance to know how well a payer organization is doing in driving higher quality. And of course, one of the major tenets of population health management, when you take care of a broad population like that, is when you increase quality, you lower cost of care. And of course, as you hear on TV all the time, whether it's election season or not, the affordability of healthcare continues to be a major issue in this country. But I also want to tell you about CMS. So the federal government has Medicare Advantage. I talked briefly about that earlier, the proliferation of Medicare Advantage plans. So you have traditional Medicare. So anyone over 65 can sign up for traditional Medicare, it's the old 80-20 plan, or you can go into a Medicare Advantage plan, which is sponsored by a payer organization like Aetna, United, Cigna, and all these Blues plans. CMS evaluates payers through what they call a STARS program of 1 to 5 stars, and they actually have half stars. So you can be a 3.0 plan, you can be a 3.5 star plan. The point is, the more stars a payer earns through, they have triannual reviews from CMS. So the more stars a payer earns, the more revenue they collect from the federal government. And in this vein, the revenue also helps drive the fee schedule. So that's the connection. So lab values do equal quality. They're super important to a payer organization for all these reasons, from a NCQA commercial payer accreditation perspective, but also from Medicare Advantage and CMS. Okay, get back on my screen here. So listen, I know everyone is busy. And again, I thank you for your time today. Your calendars are busy. You've got a lot going on running your businesses. And we're basically here to help through our relationship with Lighthouse. So this is my last slide, our last slide. And these are basically our key points. You've got to identify and prioritize the markets. We kind of gave you some sample plans where we tend to have high success rates in getting contracts. So first things first, identify and prioritize the markets you want to be in. Secondly, a lot of you have good strategy plans, 2-year plans, 3-year plans. Those out years are important for us to know as we engage with you to identify those secondary markets. And then obviously the key here is to obtain those in-network payer contracts. It helps monetize the lab, increase your payments, and then obviously try to maximize the revenue for the lab. And with that, there you have our contact information, and we can answer more questions. In the meantime, I'll turn it back over to John.
Thank you very much, guys. That was good stuff. Really good information. Obviously hitting the mark. A lot of interaction from the audience on different questions. Looks like several of those get fairly deep or specific or complicated. So we do encourage you guys to reach out to Burns. I did put an opportunity there for you to fill out the form so you can be contacted and have a appointment scheduled so you can speak with them directly about how they can help your organization. And they can really dig deep on that in terms of getting to know what your challenges are and whether they're a good fit. I would let you know that we don't bring just anybody onto the webinars, right? So we vet this heavy on the front end, and I always test the presenters out to make sure that they can deliver on their claims prior to bringing them in front of you guys as an audience. And so we've worked with Burns for several months now, probably 4 or 5 months now, have sent over a few different customers that had credentialing challenges, have done a reference check back with those customers to hear that it went really well. They got me a network. They delivered on what they were promising to us. So I'll let you know that, you know, we really do believe that they're going to be able to do what they say they do, and they've proven to be able to do that, and would encourage you guys to take them up on it, because we know that as an industry, we're competing. You know, different labs view each other as competitors. We're competing a little bit, but more often than not, I think we need to sing the same song and be united and arms locked as we try to advocate for getting paid for the work that labs are doing, and making sure that we're being fairly treated by the payers as labs. And so I think this is a time for us to come together, and I think that you'll find some really good value in what Burns Consulting offers. So I think we're probably good here. I don't know if there's a couple questions that you guys want to grab. As I mentioned, some of them do get kind of into the weeds. Is there anything on the list that you guys wanted to tackle? Otherwise, we'll go ahead and we'll wrap up. I would encourage everybody to take a look at the polls if you haven't already. It looks like that reporting of lab test values in particular that Brian brought up at the end, 72% of you guys are not reporting lab test values. Obviously, that is an area where you can add value back to the payer, and it seems like if we can kind of align what the lab does, what the payers need, they'll work together a little bit better. So we do have a project going on, but one of our employees is doing a big project just on that topic, trying to figure out how can we better connect labs and payers so that those lab values can flow, because the infrastructure for that, it seems like it's lacking a little bit. But Brian, Brendan, any parting comments or any questions you wanted to tackle?
No, this
All
is
right.
Brian. I thank everyone for joining. I appreciated the questions and appreciate your time.
All right. Well, thank you guys. We really appreciate it. Thank you all for attending, giving us your lunch hour. As I mentioned at the top of this, we will be getting a recording out to all of you, so no need to message us about that. If you registered and you had to register to be here, you will receive an email with a link to a full recording of today's session. So keep an eye out for that, and we will be reaching out to you. If you filled out a form asking to be contacted, we'll make sure that a representative gets in touch with you soon. Thanks, and have a great day.
Thank you.
Thanks, Brian. Thanks, Brendan.
Thanks, John.
All righty. Bye-bye.